My name's Kayla. I'm going to perform administration of intramuscular injection skills video. So first I want to verify the healthcare provider's order. I'm going to gather my supplies. I have gloves, alcohol swabs, alcohol pads, gauze, 22 or 25 gauge 1 to 1.5 inch needle. I have a 3 milliliter syringe, a band-aid if necessary, and the medication vial. So next I want to verify my 6 rights of medication administration, which include right patient, right route, right time, right drug, right dose, and right documentation. I want to check the medication order in the EHR. I'm going to make my calculation dosages. I use dimensional analysis. So what I did was I did ordered dose times what's available. So I did 6 milligrams over 1 dose times 1 milliliter over 4 milligrams to get 1.5 milliliters per dose. So next, I'm going to enter the patient's room and introduce myself. Hi, my name is Kayla. I'm going to be your nurse today. I'm going to provide privacy, close any doors and curtains. Can you verify your name and date of birth? Do you have any allergies? And then I'm going to note and document allergies. Next, I'll let them know I'm going to be administering morphine medication injection today. It is used to relieve moderate to severe pain. It acts on the central nervous system to relieve pain. You might feel slight stinging and burning as I'm injecting. Some common side effects include redness and irritation at the injection site. Please report any adverse effects, which include shortness of breath or dizziness. Please report them to me immediately. Do you have any questions? Okay, so now I'm going to perform hand hygiene and wear gloves. I'm going to first, if it's a new vial, I'm going to take the cap off. I'm going to get an alcohol swab and clean the top of the cap. I'm going to get my syringe and place my needle in. With the cap still on, I'm going to pull back on the plunger to get air into the correct dose of 1.5. I'm going to take the cap off, place it into the vial. I'm going to turn it upside down and get the correct dose into the vial. Okay, and I'm going to tap on the syringe to make sure there's no air bubbles. If there was still air bubbles, I would push back on the plunger to get the air back into the medication vial, and I would go back and pull back on the plunger to get the correct dose. So without touching anything, keeping the needle clean, I'm going to use the one-hand scoop method to place the cap back on. And I'm going to show you guys that I've got 1.5 milliliters of the medication. Here we go. Okay. Next, I'm going to locate the appropriate site. I want to use the ventrogluteal site, and to do this, I am going to place the palm of my hand, the heel of my hand, on the greater trochanter of the patient's hip, my wrist almost perpendicular to the femur. The thumb would be facing the groin of the patient. The index finger is going to be pointed along the anterior superior iliac spine. My middle finger is going to extend toward the iliac crest toward the buttock. And so the index finger and the middle finger and iliac crest form a V shape, and the center of that is going to be the injection site. So we'll pretend this is it. So the center, and I can use a unopened alcohol swab as my marker. So I'm going to place that there. I do want to make sure that there is no skin irritations, edema, or bruising prior to choosing that site. I want to palpate and make sure there is no tenderness or hardness. I do want to clean the area, so I would use a new alcohol swab, and I would start from the center, working outward about 2 inches. So next, I'm going to place my non-dominant hand on that area surrounding the injection site to hold the skin taut. I'm going to get my needle, and I would make sure that I'm holding it at a 90-degree angle. 90-degree angle. I'm going to inject quickly, and I do want to hold the barrel with my non-dominant hand at the bottom, and I do want to go back about 5 to 10 seconds, make sure I see no blood. So I'm pulling back on the plunger. If I see no blood, then I will inject, and I'm going to inject at 10 milliliters, 10 seconds per milliliter. Okay, and I would wait 10 seconds. And I would grab gauze and quickly release that needle, place it into the sharps container. I would apply pressure for 10 seconds. Remove that gauze. I would clean that area with another alcohol swab, starting from the center, working outwards about 2 inches. I would place a Band-Aid if they're not allergic to adhesive bandages. Place a Band-Aid if necessary. I'm going to clean my area. I'm going to place my gloves in the trash. I'm going to perform hand hygiene and document what I did.